University of Colorado Palliative Care is comforting, supporting, and empowering.
I've been told stage 4 incurable cancer.
Palliative care is care that's provided for people that have a serious illness. It focuses on making sure that people have the best days that they can with whatever days that they have left. Palliative care focuses on people's comfort. It provides symptom management and support for the patient, support for their family, help with decision making. Palliative care is a specialized type of health care. There is a specialized training for it for physicians and for nurses, and you can receive it from the time that you get your first diagnosis. It also can help keep people out of the hospital when they don't want to be in the hospital, keep them at home. It also can make it so that we make sure we use our hospital resources for the patients who want and need inpatient resources. And palliative care is seen as really high value care.
And we work as a team, and as that we work with your primary care physician or your main physician that you already have. And our team members include physicians, nurse specialists, social workers.
Knowing that there's someone to call 24 hours a day, knowing that there's a place to turn to, they've been able to handle that for us at any time.
In addition to cancer, other illnesses that we commonly see in palliative care, it can be advanced heart disease, advanced lung disease. We see people that have neurologic diseases, really the whole spectrum of types of things that we might think of as serious illnesses.
Well, I think a lot of people don't realize that it's even an option or that it's available. When I first heard of palliative care, I thought it was sort of hospice, end of life type of thing. And even though I guess they sort of are, there's so much more that doesn't just stop at the medical.
One of the key things that we do in palliative care is we get to know the patients and their families as people as well. That's really what we do first. We get to know who they are, who they were before they got sick, and how this illness is affecting them. And it's one of the key things that Harry and our other advanced practice nurses on the service do. They really spend time with the patients and families.
She's like family.
I love her.
Harry has been, she's like a big sister. She cares about not only that your medical needs are being taken care of, but she wants to know that you're okay.
The University of Colorado Palliative Care program is unique in that we have clinical programs, we have educational programs, and we also conduct research that is advancing the field. So we have a close link between what we're able to offer our patients clinically, as well as making those as teaching experiences for our students. So we're making sure that we are educating the next generation of palliative care providers. And our providers also conduct the research that informs our practice to make sure that we're offering the best possible clinical care that's out there. So people often ask us, how do you do this work? That isn't it hard to be working with people with serious illness, and particularly people that we get to know who then are likely to die soon? And I think all of us would say that it's a real privilege, that it's a real honor to be able to help people at this time in their life, and that if we can make that time of their life and for their families better, that there's actually nothing more satisfying in medicine.